Hello and welcome to the latest CMRITO webinar. My name is Tina Langlois and I'm General Counsel with the CMRITO, and it gives me great pleasure today to be presenting to you on the issue of consent. The CMRITO has recently updated its What You Must Know About document related to consent, and this webinar is a companion to the update of that document, which we hope you'll find useful. So why is consent important to MRITs in their day-to-day practice? Well, it's important because patients are required to consent to a number of things throughout their treatment in healthcare. Patients need to consent to their treatment. They need to consent to the procedures that they undergo. They need to consent to being positioned if that's required as part of the procedure. And they need to consent to being touched if, again, that is part of the procedure as well. So you can see that in any procedure that an MRIT carries out or treatment in Ontario, the issue of consent is very important to ensuring that you're providing ethical and competent care. Consent is not a form or a signature, which is something that some people think it is. You get a consent form signed, and that is evidence of consent. It's evidence of consent at a point in time, but consent can be withdrawn at any time. And so consent is really an ongoing continuum, continues throughout the procedure, and continues after the procedure as well. If, for instance, a patient needs to get gowning instructions or follow-up instructions or have something cleaned off their body, those are all things that will require patient consent and patient understanding. So consent is not, in fact, a form. It's not a point in time, but it's rather a continuum that must be addressed throughout a procedure. Where can MRITs look to understand their obligations and responsibilities related to patient consent? There's a number of different areas. So first of all, the Healthcare Consent Act in Ontario is a provincial piece of legislation that applies to any form of treatment that a patient gets in the province. And so that relates to every procedure that an MRIT carries out. In addition, the CMRITO standards of practice have a number of standards that specifically address the issue of consent, and we'll review those today as well. And then finally, the CMRITO Code of Ethics also speaks directly to the issue of consent and is something that MRITs must keep in mind. So let's start with the Healthcare Consent Act. The Healthcare Consent Act in Ontario essentially is based on the concept that there should be no treatment carried out in healthcare without the informed consent of the patient. So what does that mean? Informed consent means the consent is voluntary. It means that the patient understands the risks and benefits associated with the treatment that's being suggested or proposed, and understands the alternatives and the outcomes should they decide not to pursue or consent to the treatment. Obviously, in order for all of this to happen, the patient has to be capable to provide their consent, which is not always the case. For instance, for very young children or individuals who have dementia or have lost the capacity to consent to their own treatment. In that case, the consent would be obtained from what's called a substitute decision maker. Usually, in the case of a small child, it would be their parent. In the case of an older individual who suffers from dementia, they would have a substitute decision maker named in their power of attorney or otherwise designated under the Act. Usually, though, MRITs will be getting consent directly from the patient to whom they're providing treatment. Let's talk a little bit about the standards of practice that apply directly to MRIT practice and consent. First of all, Standard 1, which talks about legislation standards and ethics, requires MRITs to comply with provincial legislation like the Healthcare Consent Act, and also requires MRITs to comply with the standards of practice. So we'll talk about a couple of other standards that speak directly to the issue of consent. Standard number 3, which relates to diagnostic and therapeutic relationships, requires that MRITs ensure that consent has been obtained. Generally speaking, that will be by the patient presenting a requisition for the treatment that was ordered. But we'll talk a bit about that later. MRITs are also required under this standard to assess their patient before, during, and after the procedure and respond to any changes to ensure that consent is maintained. So what that means is that that just reflects the fact that patients can withdraw their consent at any point in time, and also reflects the fact that a patient may lose the capacity to consent to treatment during a procedure. So for instance, if someone is rendered unconscious during a procedure, they no longer have the capacity to consent for you to proceed with that procedure. So those are just a couple of examples. There's the last standard that relates to consent is standard number 5, which is relationship with patients. That standard requires that MRTs provide clear and understandable information before, during, and after the procedure. So while I mentioned earlier that you can assume that the patient is consent to the treatment by the fact that they've turned up with a requisition or order for the procedure that you're going to carry out. However, that's not where the consent journey begins or ends. MRITs are also required to answer questions that are within their scope. So that will require you to explain what's going to happen during the procedure and answer any questions the patient may have. Important to remember that the physician or other healthcare practitioner who ordered that procedure will not be familiar with your facility, will not be familiar with your facility's protocols or policies, and therefore would not have had an opportunity to explain to the patient how the procedure will be carried out and what will be required of them. So that's very much something that an MRIT has to do as part of maintaining consent to treatment. If you get questions from a patient that are outside your scope, then you're required to refer those to the ordering physician or other healthcare practitioner. The standards require that you only proceed with consent. So again, just outlining that you cannot carry out any kind of procedure or treatment without consent. In addition, the standard requires that our members explain why and when and where they might touch a patient if they are required to do so during a procedure, for example, for positioning or placing a transducer on a patient. You're going to want to explain all of that and ensure that the patient has given you consent to proceed prior to proceeding. Cannot touch a patient without their consent. That is entirely inappropriate. If the patient does not consent to you touching and the touching is required for the treatment, you'll need to explain to the patient that the treatment or the procedure will have to be stopped because you can't go any further without touching them in the way that you're proposing. Let's turn now to the Code of Ethics and talk about ethical principle number 2, which is the responsibility that MRITs have to patients. Our Code of Ethics states that members act in the best interest of their patients by upholding the principle of informed consent, including the patient's right to refuse service. And that's very important and becomes even more important if an MRIT is proposing a procedure that is by way of medical directive or protocol. And we'll talk a little bit more about that as we go through the webinar. Let's first turn to direct orders, which is by far the most common type of order that an MRIT gets for a procedure. So in that case, the proposer of the treatment is usually a physician or whoever other healthcare professional has ordered it. That individual is responsible for obtaining informed consent for the procedure being ordered. So a doctor may have advised a patient that imaging procedures are required in order to determine the source of their pain, for instance. So they're ordering an X-ray. And that they would have to ensure that the patient understands why the X-ray is being ordered, why it's necessary, and that they consent to the X-ray being ordered. And they would provide the patient, generally speaking, with a requisition that they can take to whatever imaging clinic or department they choose to attend to have the procedure carried out. So the physician in that case is the proposer of treatment and has received informed consent from the patient, has provided them with a requisition or order. When an MRIT is presented with the patient in the order, it's an MRIT's responsibility to ensure the consent has been obtained, firstly, to check to make sure, and then to ensure the consent is maintained throughout the procedure. So what does that look like? So before the procedure, an MRIT has to make sure that in fact there is an order for the procedure. You're going to want to confirm with the patient what procedure's been ordered, just to check in to make sure they understand what's going to happen that day. You're going to want to describe to the patient how the procedure will be performed. Again, the physician does not know where the patient will choose to have their procedure performed, so has no idea or no way of knowing what the particular facility that the patient chooses, what the policies and protocols might be. So that's an MRIT's responsibility to explain to the patient what will be involved in the procedure, and also what the patient will be required to do from a positioning perspective, and describe to the patient if the MRIT is going to be required to touch them through the procedure and ensure that that's okay with the patient. You're going to also want to make sure the patient gets answers to any questions they might have. Again, if those questions are outside of your scope, they should be referred to the ordering physician. How about during and after a procedure under a direct order? Well, you're going to want to make sure that consent is maintained, and that means checking in with the patient frequently, having an open communication with the patient throughout the procedure. In some cases, that may not be very long, but in other cases, it might be quite lengthy. And so you're going to want to check in with the patient frequently to ensure that they're okay, to make sure that they still maintain the capacity to provide consent to proceed, and to ensure that they haven't decided that they don't want to proceed any further with the procedure. Always explain to the patient why and where you need to touch them if you do need to touch them, and touch them only in those areas that are required to carry out the examination. Always obtain consent before touching a patient. Nobody wants unnecessary and unannounced touching, even if it is required for the procedure. Patient has the right to refuse to allow you to touch them if that is their decision. And you have to stop the procedure immediately if the patient withdraws their consent. You can't proceed any further at that point. What about in the case of medical directives and protocols? So for instance, many of our members operate in facilities that have medical directives and protocols in place where it has been approved that an MRIT can identify a particular type of patient that might require an additional examination in addition to what was directly ordered, and they are authorized to propose that additional treatment to the patient. But the word I chose, propose, is very important. When an MRIT is performing a procedure under a medical directive or protocol, they then become the proposer of treatment, because of course the physician who ordered the examination is not aware of the protocol and could not have obtained consent for the additional examination or procedure that's being proposed. So at that point, the MRIT has some additional responsibilities. So for instance, some of the examinations that are done by protocol are things where contrast is done by protocol in a department for certain examinations. Another example is transvaginal ultrasounds, which are sometimes done by protocol as part of a pelvic ultrasound. And so in those cases, it is the MRIT that is proposing that procedure that's being done by protocol or medical directive. And in that case, it requires the MRIT to do a number of additional things as the proposer of treatment. First of all, ensure that the patient is capable of consenting to the procedure that is being proposed. So you need to make sure they have the capacity to consent to treatment. Generally speaking, if they're there and they have capacity to consent to the first treatment that was ordered, they are probably going to have capacity to consent or refuse the treatment that is now being proposed under medical directive or protocol. But you do need to check and ensure. As the proposer of treatment, it's also your responsibility to obtain informed consent for the procedure that's being done under the medical directive. So for a transvaginal ultrasound, for instance, you would be required to explain why the procedure is necessary, the risks and benefits of the procedure, the alternatives to the procedure, and you have to make sure that the patient has consented to the treatment, and give the patient an opportunity to refuse the procedure that is under the medical directive. You can't just assume that because a medical directive or protocol is in place that you have the consent to proceed and do it to any patient. The patient gets to decide. The patient has autonomy. They determine whether or not they're okay with the procedure that's being proposed under the medical directive or protocol. So again, here's some of the steps you're going to want to explain before you determine if the patient is capable, explain the procedure, what's involved in the procedure, the risks, the benefits, the alternatives, answer questions within your scope. Some questions may not be within your scope and you're going to have to refer them to likely the physician who put the medical directive or protocol in place is probably the best person to answer those questions rather than the physician who ordered the initial examination because they didn't include this in the examination. You have to ensure the patient understands that their consent is informed, and you have to give them the option to refuse. And you're going to want to document that in whatever way your facility requires you to do. During and after, there's not much difference under a medical directive and a protocol. You're still going to want to check in with that patient frequently to make sure you're maintaining consent for the procedure. You're going to want to continue to always explain why, where, and when you might need to touch the patient. If you need to, touch the patient only in the areas required to carry out the procedure. Obtain consent before proceeding. And stop the procedure immediately if the patient withdraws consent. When I talk about before, during, and after the procedure, I want to make sure I include any after procedure care. So for example, if the patient has had gel put on their body somewhere because of an ultrasound examination, you are required to seek their consent before cleaning that off their body. That is not something you should do without inquiring whether that's something the patient wishes you to do. That's something the patient can very well do on their own. So make no assumptions in that regard. Even though it's not part of the actual procedure, it is something that you can't touch a patient without their consent, even if you're trying to help them clean up. You're going to want to make sure that the patient is very clear in their understanding of where you might touch them always, and that they always consent to that prior to you proceeding. I hope that that information has been helpful to you. As I said at the outset of the webinar, we have a new publication that will be available from the website, What You Must Know About Consent. It sets out all of the concepts that I talked about today in a bit greater detail, gives you some links to the legislation should you want to dive deeper into that. Also will provide you with more information about the standards of practice, and included in that is a checklist for both direct orders and medical directives, just as a reminder to the steps you have to go through to ensure that you have maintained and obtained informed consent for every procedure that you carry out in the province. This is our contact information. If you have any questions, you can always email the folks at Practice Advice. They're happy to answer any questions that you might have. So please feel free to reach out with any questions at all. Thank you so much for your attention this afternoon. Hope you enjoy the webinar, and I hope this information has been useful to you.